Welcome, Linda Galashaw, City Post and Review, here at the Palestinian American Community Center located in Clifton, where we are having a drug prevention symposium. I have with me a round table of professional doctors to discuss drug prevention. Welcome.
Thank you.
Now let's do an introduction.
Okay. I'm Dr. Akil, the President of the National Arab American Medical Association, New Jersey. We are a non-profit, non-religious, non-political organization, educational and charitable, and we decide to do this event, first symposium, for our community so we can educate our community about this epidemic crisis which affects every age, every race, every religion, every party affiliation, every economic class, and we have three main speakers. We have Dr. Hamdan, we have Dr. Rosenberg, and we have my wife, Dr. Al-Shroof. She is also helping me in organizing this symposium.
This is wonderful. You had a full room.
Yeah.
Full room. You had great participation. Let's just get your title, your names again and titles.
My name's Mark Rosenberg. I'm Chairman of Emergency Medicine at St. Joseph's University Medical Center in Paterson, New Jersey.
My name is Amal Al-Shroof. I'm a pulmonologist and a sleep specialist in Paterson, New Jersey, and St. Joseph Hospital.
My name is Ayman Hamdan. I'm a cardiologist who has office in the same community.
Okay, wonderful. Now the symposium included a lot of slides and charts and discussions about drug prevention as well as what causes the addiction, how depression can lead to drug abuse and addiction. Is that always the case when we're looking at depression? Does it lead to abuse of drugs?
I mean, there is association between opioid, between addiction and mental illness. So sometimes substance abuse can lead to depression, or depression can lead to substance abuse. It's like chicken and the eggs. So.
Which is first, we don't know. But you said before we start to treat the mental illness, we need to first address the addiction.
Yeah, this is what the psychiatric is suggesting. I mean, before they used to, they don't treat the psychiatry unless the substance abuse was resolved. But now they reverse the wash. I mean, you treat psychiatry, at the same time you're treating the substance abuse.
Why that, Dr. Rosen?
Well, a lot of people who have psychiatric problems like depression self-medicate by taking medications like addicting medications like opioids. So they feel better when they take the opioids. So now what happens is they get in this vicious cycle where they're taking opioids to help their depression, and their depression gets better, but they're addicted more to the opioids. So you really need to treat both parts of this equation. So you're treating not only the opioid addiction, but you're also treating the depression. One works with the other.
Now you talked about people going to the emergency room because they're in pain. And how many did you say actually received some type of drug pain?
Nationwide, the number is 17% of emergency department visits receive pain medication at the discharge.
Now you talked about also the use of prescribing these addictive drugs, that we now have options. What are some of those options other than?
Well, I think it's important that we first look at what's important here. Is physicians are not to be demonized in this whole situation. The physicians are there to help best manage their patients who come in with painful syndromes. And sometimes the best option that all science tells us is to go with opioids. There's several mistakes that have happened over the decades that saying that opioids were safe and non-addicting and that we should use them. So in our best interest to take care of our patients, we prescribe what was considered safe. When we realized the science was faulty and that these medications were not safe, many patients had already been dependent on these medications.
Right.
So that was part of what had started this crisis that we're in now of this opioid epidemic.
If I may add, we're a society who likes quick fix.
Yes.
Okay, doc, fix me up. There's a lot of ways to treat pain. Back pain is probably the #1 complaint in the country. But you go to your doctor and you want to just, jump ropes after he gives you the medicine. So we're a society who likes quick fixes. There are other routes to handle it. You can go for rehab, physical therapy, but that takes more time.
Right.
And I think it's just the mentality of the whole
Microwave age, yes.
Exactly. They want things done, they want it right away, and that's part of the problem.
That is true. I see that you've dissected pain, where you can use different medications to treat different type of pain. You talked about gabapentin?
Gabapentin, yes.
Oh, yes. Skeletal pain?
Well, gabapentin is typically for neuropathic pain.
Neural.
Yeah, so if you have back pain where it radiates down your leg, that pain is from a irritation to a nerve. So to treat that pain, medications like gabapentin are best targeted towards pain that involves the nerve.
What about the side effects of that drug? Should we not be concerned?
Well,
I think one of the side effects of that is convulsions.
Dizziness.
It's actually
Epilepsy. It can cause epilepsy.
Well, no, it's
Okay,
used to
used to
treat
be
it.
treated.
Yeah, it's used to treat epilepsy, but that's because it stabilizes the neurologic pathways in the brain, but it also stabilizes those pathways in your peripheral nerves as well, meaning the nerves in your arms and your neck and your legs.
So it would be a little safer.
It's it has maybe less side effects.
That's right.
Its addiction propensity is much less. The problem is when you look at the scheduling of drug being put as Schedule 1, 2, 3, 4. We have now 5. You got the gabapentin there. So doctors are afraid to even give the less harmful because anytime you write a prescription, your name is gonna.
Her name
It's
is
gonna
stored.
be-
Your name is
then you
stored.
So
store that.
there's a new system now to track the
Absolutely, track
prescriptions?
every
Yes.
prescription. So whether it's you're gonna give Percocet or you're gonna give gabapentin, your name is gonna be there. So I think, like Dr. Rosenberg in his talk said, the CDC might have had it wrong. Like, you got 50 million people here with chronic pain. 20 million they have crippling pain. What do we do with these people? Now, no doctor wants to write any prescription because he's afraid his name is gonna be on that
Hot list.
So now these guys are going to the street because
Yes.
and there are a lot of cases. The new guidelines increase the incidence of suicide among a lot of these patients. People like
They
veterans
don't
who
have
had
access anymore.
car accidents or have gunshot wounds. They're going from one physician to another. Nobody wants to give them the pill. Guess what? A lot of them shot themselves. So, like he said, we went from one extreme to the other. So there should be somewhere in between.
And what is the street value now of oxycodone? $30?
It's $30 for $3 for heroin, and heroin is time and a half more stronger than Percocet. It's
Yeah.
cheaper. So, and a lot of the times, people rely on the insurance. If the insurance is, the doctor's not gonna write it, no insurance is giving you the pill, you're gonna buy it from the street, it's $20-30, and you could get 10 bags of heroin. 10 bags, that's 10 treatments. But the problem is, people don't know, like the buyer is selling you heroin, he doesn't know if it's heroin.
Oh my
There was
God.
many people who said,
It's
when they were
mixed.
asked, what did
It's
you
mixed,
take, he would
yeah.
say heroin, and there was no heroin in their blood. It was all fentanyl.
Wow.
Fentanyl or mixed with heroin or mixed,
Yeah,
mixed with
lace
cocaine
them,
or other stuff.
with other stuff. So that's why the incidence of death skyrocketed in New Jersey, because a decade ago, 3% of the drugs had fentanyl. Now it's 50-60%.
Okay, so now we talk about a cure. We have something to bring overdose patients back. That's
Yeah, we have the Narcan and antidote.
what's the name of that drug?
It's called naloxone or
Or
Narcan.
Narcan, the easy name is Narcan. So
Narcan,
what
okay.
the health commissioner was trying to say that they're trying to make it easily and readily available without even a prescription. So
Okay.
anyone who goes to a pharmacy and asks for it, it should be given to them without having to have a prescription on, so it can be
Because it saves
given.
lives.
It should be
They're
available
trying
with
also
AMT.
to make it available to every EMT in abundance. They're trying to make it available for people. Now they're trying also to establish like clinics where you can just give it there. So people who know they have a problem, it's easier than just taking them to emergency room.
Well,
Trying
right
to make
now,
it available in private doctor's offices.
But right now, who has the ability to administer that shot?
Anyone. It's not
Yeah,
just
but
the shot,
this
it's
is emergency
also
room.
emergency room,
You know, I mean, in
EMT.
the acute cases,
Yeah.
usually they're given in the muscle, so you inject, they don't
Or
establish an
nose.
IV. No,
Or in
there
the
is,
nose.
there's a spray, nasal spray, or they just inject it in their thigh or
But you need
their
a prescription right now for that.
shoulder. You need a prescription
And
and you
you're
need
trying
to
to
have
get
it.
it, right,
And
and
you know,
you need to have, right.
Some actually advocating, like, if you have a patient who is on Percocet or any of those, you give them Narcan with it as part of the prescription. In case something wrong happens that he has, because guess what? This is the only way we can save lives. It does work within 2-3 minutes, and you should see when patients are out and you give that injection, they just wake up like from the death.
Wow.
And unfortunately now the new kind of drugs, they're so strong that you might need 8-10 injections to get them out of harm's
The
way.
respiratory depression that happens. with
It completely shut your
Can
breathing
you
system.
overdose on that? Can you give a patient too much of that and cause a harm?
No. The only thing that you do is if somebody is deeply comatose and not breathing from the Narcan, from heroin, when you give the Narcan, you reverse the heroin completely, and then they can be in withdrawal. But withdrawal is not life-threatening. It's not comfortable, but at least you saved a life, and now you can manage the withdrawal piece.
So we're suggesting more counseling, more.
Education.
Yeah, more
Education,
education,
parents,
more
parents.
prevention.
More
This
education.
is like I said, this is like somebody's hemorrhaging. You can give him as much blood units as you want, as long as you don't stop the hemorrhage. In my dictionary is, I think prevention is better and cheaper than cure. You have to educate the public that if you love your kids, if you love your child, you have to watch them and you have to keep an eye on them, because the next time you open the door, he might be dead. It's too late. We owe it to our children to educate them how bad this, and many times, they say for everybody who dies, there are 10 who overdose, and there are 30 who went to the emergency room with abscess, boils, infections.
You talked about the signs of depression or mental illness. What are some of those signs that parents can look for?
or addiction or using of drugs.
Yeah, I mean, we
The
talked
use of
about
drugs.
the signs, like you have to watch your kids. They're always in the room, they're locking doors,
behavior.
they're always
To
on their
socialize, to
phone.
isolate.
Sometimes
now
it's-
you're getting in trouble. Your car may be painted. You're saying take the phone, watch the phone and the locking of the doors in the room.
I mean, you have to be to
How
watch
many
these
kids are on
things.
their phone all day long,
But
even
like
adults?
Or
these-
change in behavior.
Yeah, that's like
Changing behavior,
those kids are.
isolation.
They look always tired. They're exhausted. Sometimes they're up 3 nights, and sometimes they sleep for 3 days. They're poor hygiene. They always smell. If they're shooting drugs, it's so hot, and they have those long sleeves. They don't want anybody to see them. Girls are. We keep talking. It's not boys. It's not a man issue. Now,
It's everyone.
500% increase in women addicting to these things. It's common among parents. 1 out of every 4 kids grow up in a house where there is a drug issue. And many experts say if your child is an addict, there's a problem. There's a family issue. It doesn't come from nowhere. So it has roots. It has, mental issues. There are like 50 million people in this country with mental health issues. And it all, kind of interferes with each other. But as a parent, you have to be observant. You gotta watch your kids because you are saving their lives.
We had talked tonight about the 3 parts to the stool, the 3 parts to the equation to get us out of this opioid epidemic. And